Welcome to the Digital Health Pulse. I'm Trevor Yasinow. Let's jump into today's conversation. Hi, everyone. Welcome to another episode of the Digital Health Pulse video series with myself, Trevor Yasinow. I am joined today by Jenna Hall, Executive Vice President and Head of Sales with Rightway. Welcome, Jenna.
Thank you. I'm excited to be here.
Yeah, happy to have you. So, Jenna, just to reiterate, for everyone watching, for everyone listening, the reason why I wanted to have you on and do this is that I wanted to create a very digestible, easy to watch video series that highlights innovative companies and leaders in the digital health space, providing high level overview of what these companies do and how they differentiate themselves. So, with that being said, I would love to ask you, just can you tell me more about Rightway?
Yeah, so again, thank you for having me, but it's such an exciting time at Rightway. And one of the reasons I joined is there's very few times in someone's career where there's, a really sort of hot therapeutic area or something that, is top of mind that kind of everybody is talking about. And it was actually interesting. Last April, I was at the Business Group on Health conference in Tucson, and Mark Cuban at Cost Plus was on stage, and he was talking about the PBM world and just how broken healthcare is and the lack of transparency. And he definitely got my attention, and I started looking more into Rightway because one of the things he said I thought was really fascinating. He said, the reason we, Cost Plus, didn't decide to build a PBM was because Rightway was so much further ahead. So that's sort of how one of the reasons I landed here. But what's really cool, I think, about the inception of the company. So it was founded in 2017 by a father-son duo. So Jordan Feldman had worked in finance for quite some time, and his dad, Dr. Ted Feldman, is a cardiologist. And what they found just over the years is people would just constantly come up to Ted and ask him for medical advice. Or,
Sure.
he's a cardiologist, but like, I hurt my knee. Who's the best orthopedic surgeon? Or, my mother's having eye problems. Who's the best ophthalmologist? And what they both sort of realized in tandem was that there was such an incredible benefit and advantage to having a doctor in the family. And so they wanted to create Rightway with this concept of all people having a doctor in the family and all people having access to, clinically led, clinically appropriate, best in class care to help improve, outcomes, member experience, and then ultimately cost. So they started as a care navigation company in 2017. The product is alive and well, and it's really exciting to see how it's evolved. But that's sort of the gist was there's this
That's awesome.
desire for Jordan and Dr. Feldman to really create a company and an organization that was going to help members navigate their healthcare journey, have access to clinical providers in like a concierge way where, people were leading with empathy and helping people like better understand their benefits, help drive utilization to appropriate care, and essentially, help with some of those nightmare issues that come with navigating the healthcare system, billing issues, explanation of benefits, helping with claim denials. To just have that lifeline was really sort of the inception for the company.
That's awesome.
Yeah.
Thank you. Yeah. So understanding Right Way, what makes the company unique compared to others in the industry?
So I love this question. Thank you.
Yeah.
What we are seeing in healthcare is just completely out of control, right? The
Right.
spend is off the rails. And when you talk to buyers and brokers, we are seeing incredible trends in healthcare spend. So pharmacy and PBM is one of those big drivers. So what I think and find to be so passionate about what we're doing over here is that we have created a PBM that has no conflict of interest. It is truly an opportunity to have aligned incentives with the buyer and the end user, the consumer. And what I mean by that is, we don't own our own pharmacies or mail order. So there's no incentive to drive members to a certain pharmacy to be able to profit from a margin or a spread on the cost of drug. We do not do that. We are 100% transparent. that we will pass through 100% of any rebates. We let people know exactly what the medication costs, and we use best in class technology on an app and through our portal to show members, like, here's where you live. Here's, within a couple miles of where you live and work, and here's what your medication will cost at each of the different pharmacies. So our goal is really to get members to the lowest net cost prescription. And we do that in a number of ways. But what a lot of people don't know is that physicians will sometimes just write a prescription based on solving whatever problem the member has in that moment, right? It's a class of
Hmm.
drugs. But the provider doesn't necessarily know what the member's insurance is, and they may have an MA or a PA or someone else within their staff just, look up the prescription and send it. But what we do within our PBM platform is we have pharmacists and certified pharmacy technicians that are helping manage and engage members to see if there's an alternative, right? Does the
Right.
patient clinically need a brand drug, or could they take a biosimilar or a generic? And we will work and we will call the provider. We're not acting as the provider, but we will work with the provider to say, like, hey, this prescription was ordered. Would it be appropriate for this member to switch to a lower cost drug with the same clinical efficacy? And we can save patients hundreds and thousands of dollars. So I think, when employers are worried about fiduciary risk and
Mhm.
compliance, like, we're a really safe option because the member is sort of the North Star, or, the center of everything that we're doing. We want people to be able to afford their health care, to be able to afford their prescriptions, to be more compliant with their prescriptions, and to know where to go and, how much it's going to cost.
Makes complete sense, Jenna. And just with Rightway, is there anything else that differentiates the company from others in the space?
Yeah, I mean, I think if I left you with like sort of the biggest value add or takeaway is we are willing to go at risk. We're so
Wow.
confident in our ability to deliver meaningful savings to employers that we will offer on the PBM side a PMPM guarantee.
Jeez.
So we are really willing to put our money where our mouth is and give employers confidence that what we have told them we will deliver, that it's guaranteed and we will take on the risk. So I think that on the PBM side, just everyone should know we're so confident in the opportunity to save employers money. We're going to go at risk. And then on the clinically led care navigation side too, like, we'll offer a guaranteed 2-to-1 ROI. And if for
Wow.
some reason we didn't hit that, we'll write a check. So those are two huge components of, where we're committed and dedicated to saving money.
That's incredible. Yeah. As a digital healthcare recruiter, that is music to my ears, to my candidates' ears, hearing a company would go at risk, just
Yep,
saying, okay, for their solution, like, we'll put our money where our mouth is. So super
exactly.
helpful.
It's an exciting time, and I'm proud to be here. So
Awesome. So with Rightway, who are your primary customers and how do they benefit from the solution?
yeah, so we are typically focused on self-insured employers, self-funded employers, ideally over 1,000 covered lives. There's exception to every rule. We
Sure.
have a number of wonderful, fantastic customers that are under that threshold, but we are inundated in the best possible way with RFPs right now. I mean, it's March.
Yeah.
We've had over 100 RFPs
Jeez.
on the pharmacy side, and so it's one of those really rare opportunities to, get our solution out there and educate employers on why we can really be such a good partner for them and where we can save them an incredible amount of medication and reduce sort of the burden on the employer. We're going to do a lot of that heavy lifting. On our clinically led care navigation side, we are seeing that we're saving employers, 12 or more hours a week,
Wow.
and where HR teams are limited in bandwidth and people are doing more with less. And, you can ask an HR leader and they say they're wearing 3 or 4 hats. For us to sort of take some of that heavy lifting off so that the members are calling Rightway instead of calling HR, it's a win-win, right? Like, we want to really
Definitely.
help make members healthier, give them a better experience, and reduce overall spend to the employer and the member.
Makes a ton of sense. So, understanding the space now, what is one exciting trend that you're seeing in digital health?
So for sure, PBM, everybody's
Yeah.
looking. It's the reason I joined. people, I think historically were doing some benchmarking and looking, but we're hearing from brokers and consultants this year that they're looking now to buy to actually make a move, especially away from the big three. CVS, OptumRx, and ESI have owned, 80+ % of the market for decades. And, there's a lot of issues and sort of gaps in that model. So I think, certainly PBM, and it's why we're here.
Yep.
But I think there's also some really cool things happening in AI. There's a lot of exciting, I think, fascinating opportunity to find ways to be more efficient. But I think that can also be, a little scary because you can kind of
Sure.
get caught up in trying to do more using AI, and then you have to be kind of careful about what information you're putting in and feeding it. And then you still need a human at this stage to double check it.
Yeah.
But I think there's a lot of really cool opportunity and interest to see where it makes sense and where it's appropriate, and how it's going to help sort of change the future and protocols and analyzing data. A lot of the data that all companies are trying to report back to employers to show the return on investment, which is, critical to whether or not a solution is successful. Hopefully there'll be opportunities to leverage AI to figure out ways to, look at data and stratify it more quickly and efficiently. So I think that's really cool.
Definitely agree. Yeah, it's scary, but it's exciting.
Exactly. I'm like, it's
Right.
exciting, fascinating, and slightly terrifying.
Yeah.
And then one other area that I think is fascinating is, the GLP-1s. Everybody's talking
Yep.
about them. There's a lot of concern about the increase in spend, right? If GLP-1s are offered for non-diabetics. And so there's, a real curiosity and an intent to come up with some guardrails or guidelines to make sure that, the medication is being used appropriately, and that members are going to have like the best optimal outcome. So that's another place that we're hearing a lot of noise, and people are trying, I think, to figure out the best way to solve for doing right by patients, but not letting the horse completely out of the barn, if you
Right.
will, on just outrageous, incredible spend that maybe otherwise hadn't been planned for.
Completely get it. So, my last question for you, what does the next year look like for Rightway? Any big goals or milestones on the horizon?
So many big goals. Like I said, it's a really incredible time to be in this space. We've had some incredible wins, and clients are happy. And that's ultimately, you want happy, referenceable clients. And so we are really focused on sort of this blitz scale where as many employers and members have the opportunity to take advantage of lower cost prescriptions and just overall better clinically led care. I've been in healthcare since 2001, and I hate enrolling in benefits. I
Yeah.
wait till the last minute. It's
Yep.
exhausting, and then even when you're registered, it's still like, I don't want to call. So
Right.
we're excited for people to get to see what it is we're doing and how we can help, and use our technology and the clinicians to just help people in moments that matter get to the right care. And overall, you want people to thrive, not just survive. So I'm excited. We've got some really big goals, and I think you're going to be hearing a lot more about us and what we're doing in the space.
It's amazing. No, it was just so great to learn more about what Rightway is doing in the digital health space today, and I'm looking forward to seeing all the exciting things that the company will be doing. Thank you so much for joining me today, Jenna, and really look forward to seeing your success and the company's success.
Thank you so much, Trevor. It was a pleasure to chat with you. Thanks for giving me the opportunity to chat about Rightway and all the cool things we're doing. And hopefully I'll see you at either Conference Board or BGH or one of the other events that we normally run into each other.
That's a wrap for this episode of the Digital Health Pulse. A huge thank you to my guest today. If you enjoyed this conversation, be sure to like, repost, share, and follow for more chats with the top innovators and leaders in digital health. Have a company you'd love to see featured? Drop a comment or reach out. Thanks for watching, and I'll see you in the next episode.